looking at the parathyroid, the parathyroid diseases, and we'll be looking at the types and what comes under them. So firstly begin with questions. The first one is the chronic kidney disease. The chronic kidney disease, it falls under what category of the parathyroid disease? The second question will be true hypoparathyroidism. So this forms, so under this true hypoparathyroidism, what are the diseases under this? So in this video, we'll find the answers to this and learn in detail. So to begin with, firstly, we have the primary hyperparathyroidism. So the primary hyperparathyroidism, it includes the parathyroid. This is the adenoma. So parathyroid adenoma, if you see, it is MC, that is the most common. Next, there is also the chief. There is a chief cell. This is the parathyroid. The chief cell parathyroid, this is hyperplasia. Next, we have the parathyroid gland carcinoma. Next, we look at the secondary hyperparathyroidism. So under the secondary hyperparathyroidism, it includes the CKD. Next, it also includes the vitamin D deficiency and the gastrointestinal malabsorption. Now moving ahead, we look at the true hypoparathyroidism. So under the true hypoparathyroidism, so under this, the categories include, it may be iatrogenic, then it can also be autoimmune, and the presence of the DiGeorge syndrome as well. Next, we look at the PTH independent hyperplasia. The PTH independent hyperplasia. So the PTH independent hyperplasia, this includes the presence of the malignancy. So malignancy can occur, as well as it can be the vitamin D related, and there can be the excess of the calcium intake. So this was about the parathyroid disease types and the examples. So now to answer our questions, the first question we asked was the chronic kidney disease. Where does it come under? Chronic kidney disease, it comes under the secondary hyperparathyroidism. So the second question we asked was in case of the true hypoparathyroidism. True hypoparathyroidism. So under this comes under, this has variety such as the iatrogenic, it can be iatrogenic, it can be autoimmune, as well as the presence of the DiGeorge syndrome. This is all coming under the true hypoparathyroidism.